Let's get juicy today. Let's talk about hormones for sexual health and sexual performance. I have to say, one of my favorite things is when a patient comes back and kind of a little bit bashfully tells me about how their sex life is so much better, their libido is so much better, and then how that's impacted their relationships and just the rest of their life. Sex is such an important piece of a marriage, of a relationship. And when that's not going well, when libido is down, when performance is an issue for men or for women, that's a real downer. And to get that back for somebody, it just brings me so much joy. Certainly, hormones are one part of sexual health and performance. And when we think about hormones and the sexual sphere, it's typically we're thinking of for women estrogen and testosterone, some progesterone, certainly DHEA as well, and then cortisol and stress and all of that. I will tell you, what I see most often is that low testosterone is most often the culprit for a woman's low libido, and for that matter, a man's as well. Now, it's interesting because when we talk about sexual performance and even anorgasmia or the ability to climax, neurotransmitters play a big role there too, particularly dopamine. And did you know serotonin actually can decrease climax ability and sexual enjoyment? And that's one of the reasons why antidepressants actually can cause low libido, anorgasmia, and kind of other sexual side effects. So keep that in mind, and especially keep that in mind when you're looking at different adaptogens, for example, or thinking about taking 5-HTP, which is a serotonin promoter. If there's any sexual issues, you want to kind of be cognizant of that so that you're not actually worsening your issue, or if you're a provider, you're not actually worsening your patient's issues. Besides hormones, there certainly are other issues that can be at play here when we're talking about sexual side effects or sexual decreases of function or libido decrease. Age, yes, is an issue. However, you're never going to hear me say that, well, you're too old for that, or that's just part of aging. I really want to help people kind of achieve and perform at whatever level that they feel is appropriate for them, kind of no matter their age. So I'm never going to tell a 70-year-old, well, you don't really need to work on that because you're 70. Not at all. I usually tell them I hope they are able to have sex and want to have sex till the day they die. So that's my approach. Other issues, certainly menopause for women, perimenopause, and andropause, as it's called for men. As we age, we do lose some hormone, and that absolutely affects our sexual picture. Medical conditions, heart disease, diabetes, thyroid issues, adrenal issues, any kind of medication that you're on, some more than others, can affect things like libido, sexual performance, and ability to climax. There are some different issues when we're talking about sexual dysfunction. It could be a lack of ability to maintain an erection for a man. It could be for a woman more vaginal dryness issues. It could be, yeah, lack of desire on either end, right? And there's lots of issues at play. And again, this is where the functional medicine role and kind of approach comes into place. Is we look at things from a multi-cause standpoint. So even if I, help somebody with their testosterone, if their dopamine is still off or their cortisol is off or hypothyroidism still is playing a part in negatively affecting their sexuality, we want to deal with that too. So we have to get a complete picture and treat everything holistically. Hormone therapy is one of the probably more effective options in treating sexual dysfunction of any kind. And with women, it's so often missed that they need testosterone. One of the reasons for that is that it's not pharmaceutically commercially available. So when I prescribe testosterone for women, it is compounded, and we can give a very small exact dose for what each woman needs, not give a man's dose to a woman. What we want to do though is test. I almost would never give a woman testosterone or a man without first getting a level, A, as a baseline, and B, just to verify that that is at least one of the things that's going on before we give something like testosterone. Certainly for women, estrogen can be an issue as well. And in rare cases for men, either too low or too high definitely can affect the sexual picture for both. When I think about replacing hormones, the most common way that I am comfortable with and that I think is easiest for the patients and most effective is a topical cream. And we'll do estrogen that way, we can do DHEA that way, we can do testosterone that way. And it's a daily application, really easy, just get in the routine of doing. There are rare cases where somebody does not absorb transdermal or topical cream hormones as well. And then we can move to maybe an injection, even sometimes progesterone. I will typically give orally as a first step. Now, as I said, hormones are part of the picture. I also want to make sure that my patients are eating as well as they can, anti-inflammatory, low sugar, low carb, higher protein, appropriate fats, no seed oils, limited alcohol, some caffeine because coffee's delicious, but not too much such that we're stressing ourselves out and creating way too much cortisol and tanking our adrenal glands. So all of that has to be a picture of the sexual health evaluation. If any of this has sounded interesting to you, or maybe you need help with this, or somebody you know needs help with this, we at Nourish House Calls we offer free 15-minute discovery calls. I want to have an option of connecting with a patient before the initial appointment, and so that gives an opportunity for you to tell us a little bit about what's going on with you. Make sure that it's something we're comfortable treating and are expert at treating before you even set up your initial paid appointment. You can click the link or go to our website, nourishhousecalls.com, if you're curious about setting up that discussion.